Okay, secret number 2 of the interview and physical examination secrets. Number 2 is to examine for the impairments. Know the impairments for each body region and examine for the impairments. And this is an interesting concept, and it took me a long time to be able to grasp it. Or I should say it took me a long time to be able to modify my procedures in order to adapt them to the permanent impairments as they're described in the AMA guides. And let me explain what I mean by that. What I mean by that is that if you're anything like me, and that is a long-term practicing doctor, I know, just speaking for myself, that over the years, I had kind of gotten into certain procedures and certain habits and certain ways of doing my examinations over the years of seeing patients in my practice. Well, QME patients, injured workers, for whom we're making a determination of permanent impairment, require sometimes examination procedures that are different from the way that we do those in the office setting. For example, I'm a chiropractor, and I was taught in chiropractic school several chiropractic tests and orthopedic tests and neurologic tests and named mnemonic tests. And so, for example, we have positive Kemp's tests, and we have Milgram's tests, and we have Bechtereau's tests, and Goldwaith tests, and all these different tests. And I remember when I started doing my QME exams, I would write reports, and I would say, he has a positive Milgram sign, and a positive Braggart sign, and a positive Dugas sign, and all of that stuff, and all of those findings, while they were valid findings in the setting of the chiropractic office, were not consistent with the findings of impairments as they're described in the AMA guides. And it's taken many years to sort of wrestle this huge barge, or this huge ocean liner of 20 years of examination procedures, and to get it turned around into a way that is consistent with the impairments as they're described in the AMA guides. So, for example, with the lumbar spine, there's a specific set of permanent impairments described in the AMA guides. And those impairments are described under the DRE system and also under the range of motion system. So, for example, some of the permanent impairments associated with the lumbar spine, and this is not a complete list, but some of the impairments for the lumbar spine include muscle spasm and or muscle guarding. Number 2, asymmetry of spinal motion. And I can tell you that asymmetry of spinal motion, as it's described in the AMA guides, that was not something that I examined for, even as a chiropractor. In a chiropractic office, I might notice that one motion was restricted and another motion was full, but I never knew that that was a permanent impairment. At least under the AMA guides, I never knew that that even existed. And therefore, I didn't ascribe much to it, other than the fact that it was an examination finding. Also, non-verifiable radiculopathy is a permanent impairment. Alterations in reflexes, muscle strength, and sensory function, those are permanent impairments. Atrophy is a permanent impairment. Radiculopathy is a permanent impairment. Alteration of motion segment integrity, that is a permanent impairment. Cauda-equina syndrome is a permanent impairment. In other words, there's many different permanent impairments in the AMA guides, and you need to specifically examine for those. In other words, a positive Milgram's test or a positive Kemp's test, or all these other named tests that we learn when we're learning our examination procedures don't mean anything except to the extent that they indicate or prove the presence of a permanent impairment. So knowing that and knowing the permanent impairments that I just described in the lumbar spine, how would a positive KEMS test correlate into anything of any significance to any of the parties? Well, that question could have several answers, but the answer that comes to my mind is that a positive KEMS test probably doesn't mean much at all of anything, at least as far as it being an objective finding that supports a permanent impairment. I guess it could suggest perhaps permanent muscle guarding, or perhaps if you have a positive KEMS test due to a facet syndrome, that could contribute to asymmetry of spinal motion. But can you see that a facet syndrome is not a permanent impairment? It's actually a diagnosis. And so a facet syndrome, although we examine for that clinically in the office as a diagnosis, and clinically that drives our treatment protocol, it doesn't drive permanent impairment. So the secret number 2 is to know the permanent impairments and examine specifically, not for the diagnosis, but for the permanent impairment. And on our website at www.easyqmece.com, we have examination templates that describe the physical examination specifically for the permanent impairments as they're described in the AMA guides. And I described earlier in this program the lower extremity examination template, and I've included the lower extremity examination template in the handout materials for this course. And if you review the examination template, you will realize that it's a far different creature from the standard examination that you're probably using in your office, and that you're probably with mixed success trying to adapt to your examination of injured workers. So review that template and see the philosophy behind it, and then adapt all your examination procedures accordingly.